So my name is Jeffrey Owen. I'm a student athletic therapist here with Edmonton Eskimos. I'm working a squash tournament today at 123 Squash Lane here in Edmonton. The closest hospital to where we are is Edmonton General Hospital, which is about 5 minutes driving distance away, located at 8900 101 Street Northwest. We've alerted EMS of the tournament going on here today, and they're aware of the protocol should we dial 911, the emergency number for today. Today I have helping me, I have Will, who's my assistant today, and I'll go over the intended signals in a second, but Will help bring over the emergency supplies if I give him the intended signal, and provide any support I need on the field. I have Emily, who's my call person here. Her phone is fully charged and she'll be responsible for dialing 911, the emergency number, if I give her the intended signal. And I have John, who's my control person. He'll help control the crowd, so he'll follow me onto the court if I go out and help control the situation around me, essentially. Today for signals, I'll use for a life-threatening emergency, hand across my chest, so that means I need the oxygen, the spine board, all the emergency supplies from the sideline, as well as 911 called. My phone is also fully charged as a backup should Emily's fall as the call person. The other signals I will use today, a fist in the air means it's a non-life-threatening emergency, but I still need 911 called as a precaution. And a hand on top of my head means that I just need extra support on the field, whether it's for just another hand for getting someone off the field or an intervention that I'll do on the field. I've checked all the supplies, they're all in working order. My blood pressure cuff, stethoscope, pen light, all the oxygen delivery supplies are up to date. I've cracked oxygen's at 1000 PSI, and I have all the medical history forms in my backpack, which I brought with me today. Yeah. So now I'm at the squash court and I'm approaching the scene. So I'm looking I'm surveying the scene to make sure it's safe. I don't notice any hazards. I don't notice any, upon approach, I don't notice any angulated fractures or pooling of blood, anything like that. I notice the patient's holding his nose. I'll check that in a moment. Yeah, so I'm gonna come in and see how he's doing. Hi, my name's Jeff. I'm a student athletic therapist. What happened?
I was lunging for the ball and guy tripped me and his racket hit me in the face.
His racket hit you in the face? Okay.
Yeah.
Did you get hit in the head at all, or did you fall and hit your head, or?
Just the racket.
And any problems moving your head at all, like moving his head side, anything like that?
No.
No? Okay. So I'm not going to take C-spine at this time. Do you know where you are right now?
Yeah, I'm at the squash facility.
Squash facility. And what's your name?
Ryan.
You said you got hit in the face.
Yeah.
With the racket. Okay. And do you know what date it is?
It's Tuesday.
Okay, so he's alert and oriented and he's talking to me, so he's ANO times 4. Do you have any problems breathing around at all? Anything like that?
No.
Okay, I'm just going to, so airway is clear because it's talking to me. Can you open your, I know it's hard with your nose, can you open your mouth? I just want to make sure. Okay, I don't see any missing teeth, loose teeth, any gum, mouth guard, anything like that in there. No problems breathing, so I'm going to clear ABCs at this time, come back to my vitals and check it a bit later if necessary. I'm just going to do a quick check for deadly bleeds, make sure there's nothing else that you might not have noticed that happened. Did you say you fell, or you just kind of sat down on the ground, or?
He tripped me.
He tripped you?
Yeah.
Okay. I'm just going to do a quick check. Anything else other than your nose that's hurting you?
No.
Are you comfortable in this position, or would you rather lie down? Or?
Yeah.
You're okay like this?
I'm fine with this.
Okay, perfect. And nothing else hurts other than your nose?
No.
I'm just going to check your pulse at your feet really quickly. So that's equal and present in both. Can you move your feet up for me, just towards your nose? Good. And push down in my hands for me. Listen to. push with this one?
Yeah.
That's pushing. Okay. Can you feel me touching this foot?
Yeah.
And can you feel me touching this foot? Okay. So I noticed he didn't push into my hand when with his right foot, so he might have a motor problem, which I'll come back to a bit later. Are you okay holding your nose, or I'll get someone else to hold your nose and just provide some wrapping or something for you,
Okay.
just to stop. Just check your distal pulse really quick. Okay, it's equal and present on bilaterally. Can you squeeze my fingers for me? Good. Relax. And can you feel me touching you?
Yeah.
In both?
Uh-huh.
Okay. So no problems with PMS in either arm. So I've got someone stabilizing nose. I'm just going to start with, it's just your nose. There's nothing else that you notice is wrong.
My nose just hurts.
Your nose, okay. I'm just going to come in and do a quick focus secondary survey. So I'm going to come in, just check, make sure your other bones around your nose are okay. So you're along your frontal bone, along your temporal bone, and your parietal bone. And I want you to let me know if there's any pain with any of this.
Okay.
So checking in the back, in the base of the occiput, along the occipital bone. Any pain with that at all?
No, that's good.
And any tenderness along your neck or along your vertebrae? Okay. Just coming along the face, so along the frontal bone, any pain with that? And coming along the zygomatic arch, pain with that at all?
No, that's good.
I'm just going to check this side. Pain with that?
No.
Okay. Just down the front of the nose. Pain with that at all?
Yeah, that's just a little bit sore.
A little bit sore?
Yeah.
I'm just going to come along your mandible. Any pain with that?
No.
Okay, I don't notice any deformities or contusions, abrasions, penetrations, burns, lacerations, tenderness, swelling, instability, or crepitus along any of those bones. And nothing along, none of the decapillistic on your nose.
There's just like a little bit of blood.
Just a little bit of blood?
Yeah.
Okay. So I'm gonna get someone, I've gauze in here. So I'll get you, you can put this, just hold this on your nose where it's bleeding.
Okay.
And nothing else is bothering you?
No.
Okay, I'm just gonna do a quick head to toe just to check. I'm not gonna call EMS at this time because I don't sense it's an emergency at all. How are you feel? Do you feel like dizzy, nauseous, anything like that? Okay.
No, I feel fine.
You feel fine. Okay. Do you have any like allergies, or are you on any medications, anything like that?
Have epinephrine and I'm on Cipro right now.
You have epinephrine. Are you? Do you have any medical conditions then?
Bee allergy.
Bee allergy.
Yeah.
Have you noticed any bees around at all? Or?
No, I haven't seen any in here.
Okay. And when was the last time you ate or had anything to drink?
About 2 hours ago.
2 hours ago?
Yeah.
Okay. And what did you have?
Just like a sandwich and a couple apples and a granola bar.
Okay. Anything else leading up to this? Were you doing anything beforehand that might have?
No, like I said, I was just playing and tripped me, hit me in the face.
Okay. And nothing else? With your leg, did you hurt that at all, or did you?
Well, that's just like the leg that he tripped.
When you tripped? Okay.
Yeah.
Do you remember what position that leg was in when you tripped, or when you tripped?
It was kind of behind, it was like behind me and I was lunging for the ball, like I said, so.
Okay.
Yeah.
Could you show me with this leg what maybe position that was in, if you remember?
Well, just like a lunge, so it was just behind me.
Oh, okay.
Yeah, and yeah, like I was maybe pushing off a bit.
Okay. Okay. And that's not hurting you at all right now?
No.
Okay. And your nose, does the pain like shoot up or down at all, or is it in kind of a localized spot, or?
No, it's just not really much pain. It's just kind of a little bit sore from getting hit.
Just a little bit sore. Okay. Have you ever got hit in the nose before? Or have you ever hurt your nose before?
Well, I mean, I've had nosebleeds before, but nothing too serious.
Nothing like this. And what would you give it on a scale of 0 to 10 right now? 10 being the worst pain imaginable.
About a 3.
3?
Not even, like a 2.
Okay. And has it changed at all from the time that it happened to right now?
It's just kind of been disappearing.
The pain's been lessening?
Yeah.
Okay. I'll check too. I'll just check cap refill at the nose. So that seems okay. Doesn't seem like there's anything impaired with the nose. I'm just gonna do a quick scan of the rest of your body just to make sure there's nothing else that we might have missed along the way.
Okay.
Let me know if there's any pain with any of this. So I'm just gonna come down along, check the shoulders. Any pain with that?
No.
Along the clavicle. Pain with that at all?
No.
And just along the back, along the spine. Pain with that at all?
Nope.
Do you have any pacemakers or medical devices, anything like that? Okay. The trachea is midline. I don't notice any fluid from the eyes or ears, just blood coming from the nose. No numbness or tingling in your nose at all?
No.
No? Okay. And nothing anywhere else, like your leg, anything like that?
No.
Okay. I'm just going to come down. I'm just going to check your pelvis stability. Can you take a deep breath in for me? Okay. And same thing with the other side. Okay. So air entry seems equal and not altered in any way. I'm just going to come down and check the legs. Also looking for decapitalistic. Any pain with that?
No.
Okay, and coming down this leg? No. Also looking for decapitalistic. Any pain with that at all?
There's no pain, but you find a bit of a deformity in Achilles.
In the Achilles?
Yeah.
Okay. Have you ever heard? Okay, so I'm gonna get someone to stabilize that in the meantime. Have you ever heard this leg before or anything like that?
No.
No. You don't feel dizzy, nauseous, anything like that? Okay. I'm just gonna expose the area to have a look. And I'll look at the other side just so I can compare bilaterally. I don't notice any difference just looking at it for decapitalistic. Oh, and with the nose, I didn't see any swelling, and when I felt it, I didn't feel any heat. Didn't see any redness or deformity.
There's a bit of swelling.
A bit of swelling. Okay. So I'll keep the gauze in it for right now, and I'll get an ice pack. So I'll get someone to actually put an ice pack on it for the meantime, just to keep the swelling down. And coming down to the leg, I don't see any swelling, heat compared bilaterally. I haven't tested function yet, but I don't notice any redness or deformity side to side. You said there was deformity before in this one?
Yeah.
Okay.
Yeah.
In the back?
There's a little bit of deformity in the Achilles.
Okay. With the deformity, I don't notice any difference in feel when I'm palpating along the Achilles tendon.
The right, there's a bit of a divot in the right one.
A little bit of a divot. Okay.
Yeah.
I'm just gonna test to make sure there's no fracture to the tibia or fibula. Or bilateral. No pain with either of those.
No.
Okay. Can you try bending your toes up again towards your nose? And then try pushing down towards you. So this one doesn't go quite as far. And it's about 50% decreased compared right side to the left side for plantar flexion. Can you turn your toes, soles of your feet inwards for me, towards each other? Good, so that's equal bilaterally. And then turn your toes outward. Perfect. Any pain with that at all?
No.
Any pain with bend your toes down?
No, I just can't do it.
Can't do it. Okay.
Yeah.
No pain. Okay, I'm just gonna test your passive motion really quick. So I'm just gonna bend your toes back. Any pain with that at all?
Just at the end, it was a little bit sore.
Just at the end. And what would you give that for a number?
Like a 4 or 5.
And where do you feel that?
Just like right in my Achilles.
Right in the back?
Like, yeah. My Achilles tendon.
Okay. And I'm gonna just try moving your toes downwards. Any pain with that one?
No, that's fine.
If I turn it in?
That's good.
If I turn it out?
That's fine.
No pain? Okay. And if I push this one down, pain with that at all?
No.
If I turn it in, any pain?
No, that's good.
If I turned out, any pain?
Mm-hmm.
Okay. I'm just gonna test your strength really quick. So, push up into my feet on both sides. Hands. Any pain with that?
No.
Okay. And then push down into my hands. Okay. Any pain with that?
No.
Okay. So your strength on this one is 5 out of 5. For this one, it's like 3+ out of 5. I'm gonna try to turn your soles of your feet in. So try to resist. Pain with that at all?
No.
And I'm gonna try to turn your toes out. Pain with that at all?
No.
Okay. So from my findings, I think you might have strained your, ruptured your Achilles tendon from the divot and the deformity that I feel, as well as the pain. What I'll do for right now is, you still have distal pulse, so it's not really a limb-threatening emergency. But what I'll do is, maybe I'll split it for transport. Do you have someone that can drive you to the hospital or somewhere to get it checked out?
Yeah, my parents are here watching me.
Your parents? Okay. We'll get them to take you to, maybe we'll just take you to the doctor's office just to get it checked out, just to get it confirmed. Okay. For right now. I'll give you some ice packs that you can take with you to kind of keep down the swelling. Okay, so I'll use the tensor for you now. So I checked PMS before the splint. I'll just check it again quickly to make sure nothing's changed at all. So there's still a distal pulse equal and present bilaterally. Can you pull upwards on my hands? Good. And wiggle your toes for me? Good. And you can feel me touching you?
Yep.
On both sides? Okay. So PMS is fine to start. At this point, because of the injury, I'll get you to, is it okay if I take off your I'll leave the shoe on for right now. That's probably easier than trying to get it off and back on. So I'm just going to wrap it like this. I'm just going to wrap it around. Can you lift your heel for me? So I'll put some ice in here as well to keep the swelling down. Prevent hypoxic injury. And I'm going to check distal pulse underneath. Actually, I'm going to try this again. Sorry. Is it okay if I take off your shoe and sock?
Yeah.
Just so I can see what calf refill is like in your foot.
Yep.
Maybe I'll put the SLAM splint on just for extra support, and then tensor on top just to hold it in place. slide this under your foot. Get it relaxed. And you're still feeling okay, not dizzy or nauseous or anything like that?
Oh, I'm good.
Okay. So I've already checked PMS. Round back heel. I'm just going to spiral it up the length of the tibia and fibula. And ideally, I'd have someone to help me secure the splint in place. I'm just going to tape this to make sure it doesn't come undone during transport. Lift up again. And can you still wiggle your toes for me? And can you feel me touching you?
Yeah.
Okay. I'm just going to check distal pulse. So dorsal pedis pulse is still present in between the first and second metatarsal. So now we've got it all wrapped up with ice in it. You said your parents are here to take you to the doctor to get it checked out?
Yeah.
Get a second opinion? Perfect. I'd like you to keep icing it for now just to keep any further injury down.
Okay.
And how's your nose? Has your nose stopped bleeding at all?
Yeah, it has.
Oh, perfect.
There's no blood. It's
Okay.
done.
You can keep the gauze just in case it does start bleeding again.
Okay.
But in the meantime, you can just kind of manage it with gauze as needed, but it should stop on its own. Do you have any other questions?
No, that's all.
Okay, perfect.
Okay.
Thanks.